Okay. Good afternoon, everyone. My name is Lindsay Miltenberger, and I am the Chief Advocacy Officer at the Society for Women's Health Research, or SWHR. We are absolutely thrilled that you've taken the time to join us for today's conversation, spotlighting the VA MOVE program's approach to weight management, where we will learn how this program, supported by the Department of Veterans Affairs, National Center for Health Promotion and Disease Prevention, came to be, how it uses evidence in its approach, and lessons learned from the program thus far. Before we begin, I wanted to just go over a few quick housekeeping notes. First, please note that today's event is being recorded and it will be posted online and sent to all registrants following the webinar. To ask a question of our speaker, the best way to do that is to use the Zoom Q&A function, although we will also be monitoring the chat. So if you have a question at some point, please feel free to use one of those features so we can make sure we get your questions asked with time permitting. For those who may be new to us today, we're so glad you're here. SWHR is a more than 30-year-old national nonprofit organization that's dedicated to advancing women's health through science, policy, and education while promoting research on sex differences to optimize women's health across the lifespan. And our mission is to make women's health mainstream. For today's conversation, we're so glad to be joined by Dr. Susan Rafa. Dr. Rafa is the National Program Director for Weight Management for the Veterans Health Administration, where she provides clinical and administrative guidance for and oversight of the MOVE Weight Management Program for veterans. In addition to her work with MOVE, she leads other weight management initiatives and research collaborations for VHA's National Center for Health Promotion and Disease Prevention. This includes serving as co-champion for the next update of the VA and Department of Defense's clinical practice guidelines for management of adult overweight and obesity. We would also like to thank Novo Nordisk for their support of this educational program and note that SWHR maintains independence and editorial control over work products and programming. So with that, I will turn it over to Dr. Rafa for her presentation. Thank you so much for being with us today.
Okay, so are you seeing my screen?
Yes, we are.
Okay, perfect. Thank you so much for having me. I'm really happy to be here. And today I'm going to talk about VA's MOVE Weight Management Program for veterans, which is focused on improving health and health conditions and reducing risk for chronic conditions through weight loss and weight management. So here are a few goals for today. First, we're going to look at weight trends in veterans receiving care in VHA, in the Veterans Health Administration, and the benefits of weight reduction. Then I'm going to describe the MOVE Weight Management Program for veterans. We'll evaluate MOVE participation, outcomes, and veteran experience. And I will finish up by summarizing some lessons learned. So this is a slide of weight trends in veterans seen at VA medical facilities. But before I get into this, I just wanted to make a comment about body mass index. So while body mass index provides us with population level information about the veterans that we see in VA, it's important to keep in mind that BMI is not a good standalone measure of health, and it shouldn't be used to diagnose the condition of obesity. With that said, this slide does show weight trends in veterans receiving care in the Veterans Health Administration or the VA over the last 2 decades. And you'll see that the red line is the percentage of veterans with a body mass index greater than or equal to 30, which is classified as obesity. The orange line is the percentage of veterans with a BMI between 25 and 29.9, which is classified as overweight. And you can see that over the years, the percentage of veterans with BMI in the obesity category has steadily increased over time. And when we look at the red and orange, the most recent data points to the right, which are actually from 2023, we see that together when looking at overweight and obesity, 80% of veterans are in that weight status range. And of course, this is a significant challenge, not only to the health of our veterans, it's also a challenge to our healthcare system because obesity is associated with chronic conditions like heart disease, type 2 diabetes, stroke, certain types of cancer, which are among the leading causes of preventable premature death. And this slide shows weight trends by gender in recent years. So the percentage of women receiving care in the Veterans Health Administration who have BMI greater than or equal to 30 is higher than the percentage of men within that same BMI range. And this has been steady over time. So again, you can see the most recent data points in 2023, 47.8% of women receiving care in VA and 43.9% of men are in the obesity range of BMI. And a study by Dr. Breland and colleagues in VA looked at obesity prevalence among subpopulations of primary care patients. And so here we see that while the overall prevalence of obesity is high in VA, it doesn't affect everyone equally. So this slide shows the percentage of women veterans with BMI in the obesity range broken down by race and ethnicity. And the darker bars indicate a prevalence of a BMI greater than or equal to 30. That is at least a 5% difference from the population mean. So the 5% threshold was identified as meaningful. And so you can see here in looking at the darker blue lines that the prevalence of obesity is higher in these two subgroups at the top, particularly Black women. And other research has shown us actually that Black veterans are more likely to engage in the new weight management program that I'm going to be talking about, though they tend to lose less weight than white veterans. And we're working with researchers to understand more about the experiences of Black veterans so that we can address this, this disparity in weight management outcomes. And now looking back again at our entire population of veterans receiving care in the Veterans Health Administration or VA, here we see differences in weight-related health conditions. So in this slide, the blue bars represent or include veterans with a body mass index between 18.5 and 25. The orange bars include veterans with BMI between 25 and 30. And the gray bars include veterans with a BMI greater than or equal to 30. So again, orange is in the overweight category and gray is in the obesity category. And you'll note the increased prevalence of diabetes, hyperlipidemia, high blood pressure, and sleep apnea in veterans with higher body mass index. So again, comparing the gray and orange lines to the blue lines. So overall, at a population level, the prevalence of chronic conditions is increased in individuals affected by higher body weights. And this is also true for the general population of adults with higher body weights in the United States. But when we look at the prevalence of these chronic conditions in people with higher body weights, comparing veterans to non-veterans, the rates are even higher in veterans. And this is true actually even for individuals with BMI less than 25. So the prevalence of these conditions is higher in people with higher body weights. And then when comparing veterans to non-veterans, they're higher in veterans. Putting this all together, the potential impact of weight management is going to be even greater in the veteran population because we have higher, will be impacting a higher percentage of individuals. And the good news is that we know that modest weight loss has important health benefits. So lifestyle changes that produce sustained weight loss of 2 to 5% have clinically meaningful health benefits you see here. And then greater amounts of weight loss have greater health benefits. So in this figure on the left side, you see percentages of weight loss with increasing amounts going down the slide towards the bottom of the arrow. And then in the right column, you see the associated the health improvements that are associated with each level of weight loss. So again, at 2 to 5%, we see health improvements that increase as the amount of weight loss increases. And so to address overweight and obesity in the veteran population and improve the health and quality of life of veterans, the VA established the MOVE Weight Management Program for veterans in 2006. It was nationally implemented in 2006. It first started in 2005. The MOVE Weight Management Program is evidence-based and population-focused. It's a structured program that's required by our national policy. It's available to veterans receiving care at all VA medical centers, and it's led by facility MOVE coordinators and provider champions. Importantly, participation in MOVE is exempt from co-payment. Also, the MOVE program is actually an adaptation of the CDC Diabetes Prevention Program, which was designed for prevention of diabetes. But in MOVE, we're working on prevention not only of diabetes, but also other chronic conditions as well. So those chronic conditions I mentioned on prior slides. The MOVE program does include some of the structural components of the diabetes prevention program, as well as standardized lifestyle intervention. And the MOVE program implements the VA Department of Defense Obesity Clinical Practice Guideline, as well as recommendations from the U.S. Preventive Services Task Force. And I'll mention here, and I'll mention it several times throughout the presentation, that the goal of MOVE is not normal weight, however that's defined, but really the goal is clinically meaningful weight loss, modest and sustained weight loss that's associated with health improvements and reduced risk for chronic conditions. And this slide shows the key elements of weight management that are emphasized in our VA DoD clinical practice guideline for management of overweight and obesity. And just to highlight a few of the key elements here, obesity is a chronic disease that's characterized by periods of weight loss and weight gain. And so management often requires multiple clinical interventions over time, as well as long-term commitment to monitoring and self-care. Comprehensive lifestyle intervention you see in the middle of the screen is central to successful and sustained weight loss, and that's essentially what we do in MOVE, and I'll talk about that more in a few minutes. With pharmacotherapy and bariatric surgery as conjunctive treatments. So again, combining bariatric surgery and pharmacotherapy with comprehensive lifestyle intervention. And these interventions should target a negative energy balance, which is achieved through decreased caloric intake and increased physical activity. And here you see the elements of a comprehensive lifestyle intervention. So I mentioned that comprehensive lifestyle intervention is the foundation of weight management treatment. And this is the definition that we use in VA. So the elements of comprehensive lifestyle intervention include a standardized evidence-based curriculum that combines behavioral, nutrition, and physical activity components that are targeting modest weight loss, so weight loss of 5 to 10%. This intervention is delivered through a series of sessions or contacts that are part of a course of treatment. So most comprehensive lifestyle interventions offer at least 12 contacts in the first 12 months. Through the comprehensive lifestyle intervention, veterans are provided with individualized self-management support, and I'll talk more about that in a little bit. The intervention is delivered by a healthcare professional, and it's available through a variety of modalities, and I'll get to that as well. So there's a lot of information on this slide, but essentially this slide depicts the content of our curriculum. So I mentioned that we have a standardized evidence-based curriculum, and this is the content. It's essentially a toolkit that covers a range of topics and tools that you see here, ranging from exploring motivation, setting SMART goals, self-monitoring and tracking, to rethinking unhelpful thoughts, to building an activity plan, planning for high-risk situations, stress management, problem solving. So the prior slide was kind of what we're doing, and this slide shows how we're doing it. So MOVE empowers veterans to improve their health through this personalized, proactive, veteran-driven approach, also known as self-management support. And this slide depicts the process of self-management support that we do provide through MOVE. Self-management support is an evidence-based approach that's used by healthcare teams to actively engage veterans in MOVE and in self-management of their health conditions. So importantly, you'll see this is an iterative process. It starts with a relationship-based approach. It includes assessment, information sharing, shared decision-making, collaborative goal setting, problem solving, and skill building. So we're doing all of that through delivery of MOVE. And again, it's an iterative process that repeats over time. And we have flexible program participation options for MOVE. So this just shows a couple of the options, it represents a couple of the options. We have individual and group visits that can be offered in person, by phone, or by our video technology, which is called VA Video Connect. Veterans can also participate in MOVE through home telehealth, which is available for veterans who want to participate using remote patient monitoring technologies. We also have a mobile app, and we have a text messaging subscription or protocol that are tools that are available to support veteran participation in MOVE and weight self-management. So now I'm going to go over some of our data to share with you some program evaluation information. So this slide shows the reach of the MOVE program. The blue bars show the number of new participants in MOVE each year. So annually, the blue bars show that. And those numbers are depicted on the left axis. And the total number of participants is depicted in the red figure on the right. And those numbers, the corresponding numbers are on the right axis. So since the program started in 2005 with national implementation in 2006, we've had more than 1 million veterans participate. We have had some dips in participation over time, but participation is increasing again. So in 2023, we had about 65,000 first-time MOVE participants. And here we see that the proportion of women participating in MOVE is increasing over time. So looking at the orange bars, starting with 2017 on the left to 2023 on the right, you can see that the size of the orange bar is increasing. And in terms of the participation of women in MOVE, we know that women more frequently participate in group visits than individual visits, though that may be an artifact of the fact that group visits are offered more often than individual visits. And we also know that when women participate in individual MOVE visits, it's typically by telephone. And this slide shows 12-month weight outcomes for first-time MOVE participants. So the bars show the percentage of veterans who achieve clinically meaningful weight loss. Again, that's weight loss of about 5% at 12 months after their first MOVE visits. So the lighter color blue indicates the percentage of all new MOVE participants who are achieving clinically meaningful weight loss, while the darker blue bars represent or includes veterans who participated in at least 12 visits in the last 12 months. So you can see consistently over time, veterans with higher levels of participation, a greater percentage of them achieve clinically meaningful weight loss. So in 2023, close to 35% had at least 5% body weight. Importantly, veterans with any participation represented in the lighter blue line are still having a significant proportion are still achieving clinically meaningful weight loss, so close to 30% looking at 2023. And also in looking at these bars, you can see over time, the program has improved in terms of the percentage of people reaching clinically meaningful weight loss. And I did want to mention something. I did want to mention women as well. So in terms of outcomes for women in particular, there was an evaluation that was published in 2018, and it showed no differences between men and women in terms of the proportion achieving 5% weight loss. Our recent program evaluation data has shown a trend towards a higher percentage of women achieving clinically meaningful weight loss. So we're keeping an eye on that trend. And looking at veteran experience, a recent survey that was conducted for us gathered information from veterans who participated in at least 4 MOVE visits. And results from that survey showed that veterans are highly satisfied with MOVE. As you can see on this slide, the overall customer satisfaction index was 86, which is considered excellent. It's comparable to other organizations within VA, and only the the VA National Cemetery Administration has a higher score with a customer satisfaction of 96. And all 3 of the metrics on the screen that were used to calculate the CSI score, the customer satisfaction index, reflect very positively on the program. So overall satisfaction, how well the program compared to participants' expectations, and how well it compared to ideal are all considered excellent, even though the 2 of them are a little bit lower than the other. And when we look at the overall satisfaction of women versus men, women had a CSI score of 82, and men had a CSI of 87. Importantly, since we conducted this survey, we've made significant improvements to the program. So it will be interesting to see if over time there's still differences in satisfaction. These levels are pretty high, so it will also be interesting to see if we can get them even higher. And program experience was found to have the greatest impact on the MOVE CSI score that we just looked at. So the program experience score is comprised of the different elements you see here. So satisfaction that the program helped you with the veteran to make changes to their diet, stay motivated, to track their diet, make changes to their physical activity, figure out how to overcome barriers, and stay motivated to track exercise. So essentially, the core elements of MOVE are the most important drivers of overall satisfaction. And so this really, for us, reaffirms that the focus of MOVE on skills and behavior and that process of self-management support that I talked about are so important and really contribute to veteran satisfaction. And it also tells us that veterans are empowered and equipped for self-management and to manage their weight. And program personnel was actually found to have the 2nd greatest impact on the MOVE CSI score that we talked about a couple of slides ago. But this score of 92 was actually the highest rated component. So basically, this tells us that the MOVE program and the MOVE program personnel and what they do are an important strength of the program. So here it's asking how knowledgeable was the MOVE healthcare professional that you most frequently worked with? How much were they listening, answering your questions, being open to input, asking about the ability to connect with you, and coordinating with your primary care provider or team. And here you'll see that the coordination of care was the lowest rated aspect, still high at 85, but of course, it's not surprising given how challenging care coordination can be. And here we have more recent data, more recent veteran experience data. So for veterans who've actually completed the MOVE program, they have the option or the opportunity to provide feedback through a nationally standardized, voluntary, and anonymous survey. And it gathers data about staff helpfulness, veteran satisfaction and trust, and behavioral outcomes as well. And so here you can, the percentages that you see in the right column are the percent of veterans who strongly agreed with this different survey statements. So move clinician providing helpful information, explaining things in a way that could be understood, providing effective coaching and feedback, treating veterans respectfully, the behaviors that having a positive impact on their quality of life, and trusting the move team. And I wanted to share a couple of snippets of some move stories. So we continuously gather veteran move stories to so that they can share with other veterans their experiences. And I pulled a couple of snippets from women veterans to share today. All of them are available on our website. So here we have Mary Luft, who combined several realistic healthy changes to manage her weight and improve her health for good. And she says, move is different because of the ongoing support, discussion, and education provided from the veterans and facilitators. And here, Vicki Dowry resolved to reshape her life by adopting small, lasting habits that helped her achieve her weight loss, her health and weight goals. And she says, I'm so proud of myself. And here, Tammy Dearmond changed her life for the better with the support of family and expertise and accountability she found with Move. And she talks here, in her quote in particular is about her experience in the group. So the goal was always to see each other succeed and to celebrate progress and victories, no matter how big or small. And I'm going to just wrap up with a few lessons learned. So first, our national policy supports flexible program implementation. At the same time, our dissemination and implementation of standardized tools really helps to reduce local variation and support VA's goals towards becoming a high reliability organization. As I talked about, also Move and its comprehensive lifestyle intervention are foundational to other weight management treatments. With that said, an integrated healthcare system approach is really needed to optimize the benefits of all available evidence-based interventions. So, of course, Move links to the other interventions, but how that happens at the facility level is not standardized. Very importantly, weight bias and stigma must be acknowledged and addressed within weight management programming and within the healthcare system more generally. We've been working really hard on that over the last several years. Also, treatment resources need to match the chronicity of the disease. So we talked about the fact that obesity has periods of weight loss and weight gain. And so that means interventions over time are important to support veterans, and we need the resources to match that, the lifelong focus on the disease of obesity. And we have to emphasize the goal of clinically meaningful weight loss for improvement of conditions, health, quality of life, and decreased disease risk. There's still a lot of misunderstanding about what weight management is and isn't, why we focus on weight. And so really trying to educate people about what we're trying to do and is something that we are continuing to focus on. And that brings me to the end of what I plan to talk about today.
Thank you so much, Dr. Rafa. That was an excellent presentation. I also see that we have very quickly approached the end of our half-hour conversation. If you have a few minutes, I would love to ask you just a couple of questions, but I want to be respectful of your time if you have another obligation.
Sure, I definitely have time.
Okay, perfect. So one of the questions we received in the chat is, recognizing that BMI is increasingly being pushed back against as a valid measurement for overweight and obesity. Is there a process to identify overweight and obesity that is more appropriate for the measurement than BMI?
So this is an issue that's of course larger than VA, and one of the really tricky things about it is BMI is contributes to what our evidence-based clinical practice guidelines are. So what that means is basically BMI is used to identify people to study interventions on. And so it's kind of this vicious cycle because those studies inform how we think about and offer treatments. So at this moment in time, BMI does guide how we think about and offer evidence-based treatments. But that is in terms of identifying people who could potentially benefit. It is not used to diagnose people. It's just a starting point for identifying people who could potentially benefit, and hopefully a starting point for a conversation between a provider and a veteran about what may or may not be helpful to them based on other aspects of their health and functioning.
Thank you. And I know during your presentation, you referenced the fact that VA does offer weight management medications and surgery along with lifestyle changes. And I know from kind of the policy lens, a big part of the conversation surrounding weight management and particularly around anti-obesity medications is cost. So can you speak to the cost impact of the VA MOVE program or even the utilization or uptake of anti-obesity medications within the program?
So for MOVE utilization and utilization of anti-obesity medications and bariatric surgery, over time, we've seen that there's a significant difference in how much MOVE is utilized versus what medications and bariatric surgery. So we might see 60,000 new veterans, like first-time participants in MOVE, in veterans participating in MOVE in a year. We might see fewer than 1,000 bariatric surgeries occurring in a year. We might see fewer than 10,000 veterans being treated with anti-obesity medications in a year. With that, and that's actually consistent with what is seen outside of VA as well. That's not unique to VA, that there's lower utilization of these other evidence-based interventions that many more people could benefit from. With that said, with the recent FDA approval of GLP-1s for obesity, we have certainly seen an increase in demand for those medications, but similar to outside of VA, we are impacted by the drug shortages that have occurred. So even though we've had increased demand, there hasn't been supply to match the demand, and we'll certainly be dealing with the cost issues as well.
Thank you. We had another question come in. How has weight loss correlated to a reduction in medical and medication costs?
There are some papers, I think some newly published or recently published papers that I can't cite the exact findings off the top of my head. But the reason why we do offer MOVE, which is based on the diabetes prevention program, is because we know that programs like MOVE that have been studied do impact health and do positively impact health. And so we mirror the evidence-based programs that have demonstrated that.
And I'll just ask two final questions and then we'll close it out and give you back your time. One of them is, how do you reach veterans to engage? Is it outreach? Do you use a health plan navigator or a customer service representative to guide people to the program? Do clinicians know about it? Are there specific providers that refer to this program, or is it veterans facilities that refer?
Good question. So any veteran can participate in MOVE through direct referral. So meaning veterans can either be referred by a clinician or they could contact the MOVE program directly. They learn about the MOVE program through clinicians, through other veterans. We have a website. We do some marketing as well, just to let them know that it's available. But there are a lot of different avenues by which we let veterans know about MOVE. But the most important connection for them to make is to the MOVE program at the facility, because those are the clinicians that they'll be working with.
Great. And I'm going to steal Michael's question as the last one we ask. If you had a magic wand, what would you do differently with the program?
Wow, that is a very good question. it's hard, looking back, everything we've done gets us to where we are, which is a good place to be. I would say where we are at is a very exciting and challenging time. And so if I had a magic wand, my wish is that obesity medicine would be kind of even further along than it is now. It's unfolding before our eyes, and we would have a clear path for how to best combine our effective treatments.
Thank you so much, Dr. Rafa. I really appreciate you taking the time to speak with us today. And thank you to our audience for tuning in. I do want to remind everyone, whether you're new to us or you have known about us for a while, to please stay connected with SWHR through our respective channels. We of course have a website, but we're also on Instagram, LinkedIn, Twitter, or X, and Facebook. So please continue to follow along with us. We will share all of our resources related to this program, but also others affecting women's health throughout the lifespan. So again, thank you all for your time today, and thank you for being here.